music there. I kind of hoped I get to choose my song. I might have chosen Duran Duran, actually. If Hungry Like the Wolf, that's what I would have chosen. I'm going to start off. I'm Dr. Thompson, Jimmy Thompson, and I'm going to start off with kind of an interesting video clip. Yeah, have you ever been surprised by a movie, especially growing up? A movie maybe a little more serious than you might have expected, and definitely when this one came out, it was an adult, grown-up movie for me, but that ended up making a deep impression and sticking with you for a long time. Now, of course, that was the brilliant, The Right Stuff, based on a novel by Tom Wolfe. I saw that when I was 12 years old, and it really stuck with me. And I especially loved the part in the movie where the astronauts were training, and they were set to compete against each other in tests of physical endurance and concentration and focus, and I especially remember a particular scene where they showed one of the astronauts, played by Dennis Quaid, is outdone at blowing air through a tube of oil and holding a ball up, floating up above the oil. He's outdone by the astronaut played by Ed Harris, who was playing John Glenn. And it stuck with me for some reason. It really deeply impressed me. And it kind of became a joke between myself and some of the creators of this program. It came out of the question, why did you decide to be a doctor? So, it's not as if I said to the dean or the admissions director who talked to me when I was interviewed, it's because it didn't work out as an astronaut. It never got that far. But it was this idea that really impressed me at a young age, that I wanted to be like these guys. I wanted to be the best. I wanted to be special. I wanted to feel heroic. And I think that's where the idea came from. Now, it was a dream realized to become a doctor, obviously, and it was a fantastic accomplishment. But what I'm going to talk about today is how that dream was almost completely destroyed by drug addiction. And I'll surprise you to tell you that potentially losing my career was in the end really the least of my concerns, and how it ended up being that the other parts of the dangers of drug addiction really taught me about what it means to be me and what it means to be a doctor. So to tell you the story, I have to go way back to growing up. I was the baby of the family. And big family, 5 kids, kind of like again another movie, the Royal Tenenbaums. Precocious kids. They all reached their peak at about age 12, and I was right on target there as baby number 5. Parents were busy and pillars of the community we all looked up to, but we more or less took care of ourselves and all tried to be our very best person. And I was right on schedule. I could swim the length of the pool by the time I was 3. I could roller skate backwards by the time I was 4, and I was on my way, I'm sure. I was a great singer. I even had an agent. His name was Eric. He was 11. He was my older brother, and I was really doing well at backyard barbecues and family reunions until Eric was no longer able to convince me that the tears in everybody's eyes were not because they were touched by my renditions of Barry Manilow. It was because they were trying not to laugh, and I was a very serious kid, and so I couldn't have that. So I stopped being a famous singer at about age 5. But I was right on schedule, right through the first grade. But I realized over time, this is a picture of my family. I realized, of course, as I grew up, that I wasn't going to be the next Michael Jordan or Michael Jackson or astronaut. I think we got pictures of all those famous guys who I really admired and loved, but I knew that wasn't for me. And so I started to think about, well, what's an everyday type of hero that I could be? And what's the kind of hero, the best of the normal people? And I settled on this idea, I think at about 7th grade, that I could be a doctor. Because my doctor was great. Everybody loved him. He was a really impressive guy. It was a small town doctor. He founded his practice way back when. He was a grandpa by the time I came around. And gosh, we all were amazed by this fellow, and we all looked up to him. Even my dad did. And I figured if my dad respects this man, if he looks up to him, I want to be like this. And then maybe my dad will love and think I'm awesome too. And so I set out to make a goal to become a doctor. And I'll be honest with you, I don't think I really knew very much about what it meant to be a doctor at the time. I just knew it meant something special. I knew it meant that people were likely going to think you were pretty neat if you were a doctor. And I think that that's what it was about doctoring that made me excited, that made me want to strive. And that's how it was for me with everything. Interestingly, before I went to medical school, I taught grade school back home in my hometown near Fresno, California, and kind of an underserved area. They were desperate for anybody they could get. So they got this kid, this Boy Scout hometown kid, to come in and try to teach 5th grade for a school that just couldn't find a 5th grade teacher. Anyway, being in the teaching world, you definitely learn, especially in a smallish town, you learn to pick out those kids who really want to achieve and be on top. Now in the suburbs, it's almost like every kid wants to be like that. But in my town, it was pretty easy to see who were those ambitious, driven kids, and I was that one all the time. I was that guy. And I think it grew from this feeling that I had inside that if I could always win everything, if I could be the best, if I could get all the awards, that love and acclamation would come my way and I'd be satisfied, I'd be happy. And so I was a driven kid, and I was serious. I really, really thought I needed to impress my way into being loved. But the truth is, I was loved, and it was there. My parents were there for me and loved me. But like some of the earlier speakers said, I had this kind of odd complex where I thought that I needed to prove it anyway. I needed to show that I was really, really deserving of this love and this sort of admiration, and that once I got it, I would be satisfied. But I also had a fragile ego, and my ego, my reputation for being crushed if I ever lost, became almost as famous in our town as my precociousness and my drive. But I pursued this. I wanted to become a doctor. I wanted to be a hero. This is a picture of me as a teenager, and I think it was taken by my oldest brother. At this age, I had accomplished a few things, and I felt like I was on my way, and that I would, if I could become a doctor, I would really feel like I had arrived. Because I had this haunting feeling all my life that although things on the outside looked great and I was doing really well, there was just something missing. I didn't quite feel like I had the sort of the wholeness that I needed in my life. So I set my sights on medical school, and I actually I'm an alumnus of MCV. Back in the late 90s, it was tough to get into medical school. It still is. We all tried really, really hard to get in, and I decided that I would shoot for it. I loved the way that my parents reacted to this idea that I would be a doctor, even though, as I admit, I didn't know much about it. I tried different things, as most people do, who are driven by an idea that they don't understand. I wandered into different fields. I think that the only other serious job I considered was espionage. I thought maybe I would be a spy, but eventually I settled on doctor, and it made my dad real happy. and that was worth it. So I decided to apply for medical schools and get out there. And as a lot of you probably remember, I think there's some students in the room. It's a funny time trying to get into medical school because a lot of us felt like, and I certainly was one, that if I could just make it, if I could become a doctor, I would be satisfied. I would be happy. And the rest would take care of itself. Details, details, details. Everything would be fine. So like a lot of my friends, we were just trying to say just about anything we could to get accepted. And, of course, we said, we told everybody, told the interviewer, we all wanted to be in primary care, and we wanted to stay right here in Richmond and right here in Virginia and practice family medicine. Just please let me into your school so I could become a doctor. And they did. They let me in. And I've taken to Richmond as my home and love it. One of the funny things about being a medical student, the things I thought was interesting was we always did the white coat ceremony at MCV. I think they still do it now, because we all realize that being a doctor is special. Becoming a physician is special. It's a special moment. It's a great accomplishment. And we were all very eager to be given that first white coat. And so we have a ceremony. We still do it today. I actually skipped the ceremony. I skipped the ceremony because I wanted to make sure I didn't want to look too eager. I wanted to keep my cowboy cool. But I loved getting that white coat. There's a lot of big deal made about being a doctor. We put a lot of value on that MD. And it becomes something more than just a career choice. It really becomes part of an image. As a matter of fact, we discovered something in my class of 2004, a syndrome that was called the syndrome of inappropriate white coat wearing. And so we documented that, and some of you might see it happen in the fall down in Choco Bottom shops and along Broad Street, where young people wearing white coats in the grocery store. But I admit I was secretly one of them. But there is something special about becoming a doctor, and I was excited to be there. But I have to admit to you, the same feelings that I had as a young kid who wanted to be Michael Jackson and realized he couldn't, and Michael Jordan realized he couldn't, thought maybe I would take Ricky Schroeder's place on TV when he got too old, but I didn't. But then found a solace in academic achievement and other things. I found that when I got to medical school, despite the fact that my professors were great and I loved them, my classmates, I loved learning the material, I was disappointed. I was disappointed because of the way I felt. Here I was honored to be accepted. I knew I would become a doctor. I knew I had the capacity to do it, but I wasn't happy. I still had this empty feeling. I got what I wanted, but somehow I didn't get what I needed. And I was disappointed. I was sad. I didn't want to admit it to anybody because I was afraid that if I did, it would show some lack of gratitude. It might make people question whether or not I should be there, and that would be definitely a defeat, and I didn't want to admit that. So I kept it to myself. I became a little bit obsessed over choosing what field I would go into. That became my new thing. If I choose the right field, just the right match for me, then I will be really, truly happy. Then I will have arrived. There was more to it, though, than just even being disappointed that I didn't feel great. Medical school's hard. It was far from my family, far from home. While I was a student, my father became sick. He was diagnosed with cancer. He had a diagnosis of carcinoma of unknown primary, bad diagnosis. And seeing him deal with that, even after a year or two of remission, when it came back, I knew what it meant, and that was very hard. I was, I believe, suffering from depression at the time. Didn't want to talk to anybody about it. Didn't want to show any kind of weakness because I didn't want anybody to think that I didn't have the right stuff to be a doctor. I didn't want to have a defeat. I didn't want a mark on my permanent record. I didn't want to lose. The only choice for me was to charge ahead. And so I did. And I made it through medical school. I had the ability. But I became a lonely resident. Somebody very much isolated with feelings that I didn't cope with very well. My father passed away when I was an intern. Interestingly, I chose an internship in pathology. And I think that I could have ended up a good pathologist if I had really put my heart and mind into it, but in the end, not a great match for me. But I thought, hey, pathologists are kind of like doctors and kind of like spies because they have all the secret knowledge. Everybody knows they're really the smartest people in the hospital, even though they don't do all the stuff that everybody else does. But once again, a choice being driven by the seeking for fulfillment rather than looking at what I really liked and what I really enjoyed and who I really was. And I washed out of that pathology internship, switched into internal medicine, and it's I think meaningful that I was a pathologist when my father's diagnosis was unknown, and I wanted to become a medical oncologist when he was suffering so much in the last stages of chemotherapy and treatment. That was certainly meaningful. But I didn't get better. My dad passed away. I was really hurting from a sense of loneliness and depression. Like some of the other doctors who've spoken today, I felt very much like I just could not reach out and ask for help. As a matter of fact, many times I can think back, from the pathology faculty to the medicine faculty to friends and colleagues and students even that I was mentoring, asked me if I was okay and really wanted to know if I was feeling all right and let me know that there was help there if I wanted it. And I of course, said, no, I'm fine. I didn't want to show any kind of a weakness. I was sure that if I admitted how bad I felt, that I would fall in other people's estimations. And that this hardwired drive in me to think that to get people's love and friendship, I had to be great, was so strong, I just couldn't overcome it. And then there were drugs. I was quite a straight arrow as a kid. I want you to understand that. And came from a very teetotaler family, very religious, and I didn't even drink alcohol. My parents didn't drink, my brothers and sisters, as far as I know. Didn't drink, didn't use drugs. But I knew, even before medical school, just from the few medical or dental experiences I had with opiates, that I had a special thing for those. I liked those, and I knew it, and I remembered those. Even so much that when I was a pre-med student, we had a lecturer come in and talk about the dangers of addiction in doctors. And I can remember that lecture like it happened yesterday. Of all these pre-med lectures I went to, that was the one I definitely remembered. I was afraid of that, but I didn't want to think about it. Something about it was very real to me, very threatening. Well, as a young doctor, I found myself with access to these drugs, varying degrees of wrongness to that access, but there they were. I knew that they made my insides feel as great as I pretended my outsides were. And really, my outsides were pretty good. Compared to the rest of the world, I was in a fantastic situation. But the insides were all wrong. And when the insides are wrong, it doesn't really matter how good the outsides are. So as time went by, rather than reach out for help the right way, I found myself falling deeper and deeper into a dependence on drugs to feel okay, to be able to cope, to be able to feel whole, to be able to face the day, to be able to get through difficult things. And this went on and on until I was trapped and I was unable to get out. I tried to defeat it myself over and over again. I tried to keep it to myself so that nobody else would know. And more or less, it was a secret when finally my program director called me into her office. I was in the middle of a shift over in the emergency room. She asked me to come in. And believe it or not, this is kind of typical of addicts. I thought maybe I was going in to get an award. I thought that I was going to come in and she was going to tell me how finally they realized how great I am. And I was going to get an award. But what she did instead is she laid out in front of me all the evidence of my drug abuse. And there it was. And I, of course, I knew it was true. I was no criminal. I was really relieved, though, when this very, very kind woman, instead of throwing the book at me like I assumed she would, told me that she was concerned about me, that she knew I was a good person, that she wanted to help me. She showed compassion for me. She encouraged me to get some help, and she helped me get it. And in the end, that ended up saving my life. I I am amazed when I think about how many times, how many opportunities I had just to accept a helping hand but said no thanks. How many times I tried to cure myself, fix myself, but couldn't ask for help. Even with loving family, great friends, professors who cared and really were looking out for me, I just couldn't do it. And it amazes me. But when I was confronted with devastation, loss, and an absolute destruction of everything I had worked for and help, I was glad to accept help. I was right on board. Thank you very much. I will take all the help I can get. So sure enough, I went off to treatment. I was in the monitoring program. I was in trouble, of course, not only with the program, but the hospital, and also with the law, with the board. I was in all sorts of trouble. But what's funny is that at that moment, when that night, and I remember that one very well too, the things that I was worried about the most were certainly not mortality, not death, even though I probably should have been. I wasn't worried about the fact that I had a deadly disease that could kill me. I wasn't even really that worried about jail. I wasn't worried about losing a job. I was worried about my reputation. I was worried about my status. I was worried what others would think of me. I was mostly thinking about, oh no, what's going to happen when my classmates find out? What's going to happen when the rest of the residents find out? What's going to happen when the people at church find out? What's going to happen when everyone finds out? It's going to ruin my reputation, and it'll be shown that I never did have the right stuff, and that's what hurt. That's what scared me. I kind of hoped that maybe we could just take a month off and maybe do some group therapy or something like that, and I could come back after a month. I promise I'll never do it again, but no. We're wiser than that, and I went away for a little while. I was in treatment for 3 months, and I stayed away from the hospital, or I didn't work for a year. I sat out, and it was a tough time. I knew, though, right away in treatment that I belonged there. I knew that I had this problem. I knew that I couldn't fix it on my own. I really loved the kind of help that I was given, the compassion that I was showed. I'll tell you what, there was nothing better than the feeling of finally being able to tell somebody the whole story, the whole truth, everything I had done, unpacking it, showing it to them, telling them, just confessing it all. And not only that, but having them understand, having them say, yeah, I understand. And many of them saying, I did stuff like that too. It was so liberating. It was so freeing. But addiction's a bad disease, and it was hard for me still. I was arrested. I went to jail, only for a few hours, but it was jail. I met a nice probation officer. It was an odd experience. He had to check. He asked me if I had gang tattoos, and he had to check, and no gang tattoos. But I got through all that okay, and eventually the board was fine with me, and I was in the monitoring program. But I'll tell you what was the hardest thing I did. 2 things. The first, and this was still, I get a little bit chills when I think about it. The toughest thing was facing the graduate medical director when I came back to talk about returning to the hospital. And she wasn't easy on me. She said to me flat out, why should I let you back in? I can't remember what I said. But I think with the help and kindness of other people and my earnestness, and I think probably underneath she wasn't as hard as she appeared to be, I was allowed back in. But I have to admit to you, I wasn't well during that time. I still wasn't quite happy. I was still struggling. Even after all I had been through, I couldn't talk about it. I felt ashamed, very ashamed, and couldn't talk to my classmates, my colleagues about it. When I would go into the meetings of AA and NA, I couldn't talk to them either. I had a hard time admitting that I was this square guy with no real excuse for being an addict. And I was a doctor, for heaven's sake. I was so ashamed. Never talked about it. Struggled, hurting all the time. And as anybody who knows about this illness could probably predict, sure enough, eventually I relapsed. And so here I was in a monitoring program, having been given a second chance and I still slipped up. And now I knew this time, after a cut, this was about 2 years later, my goose was cooked. I figured I'm done. But my ego was tough, and it was resilient, and it wanted to keep going. And mind you, when I say ego, I'm not talking about necessarily self-confidence or the good part of wanting to do good things. But ego meaning I need to redeem myself. I need to win that good reputation back. I once again was in the mode of I need to find a way to get out of trouble. And I worked hard at it. And eventually I got the help that I needed. I went to, the first person I went to talk to about this and ask for help from was my sponsor, a guy I really hadn't talked to nearly enough. And his instructions to me were to find 10 phone numbers that you have of other people in recovery, call them up, tell them about what just happened to you. And I thought that was the worst advice I had ever heard in my life. That is ridiculous. That's exactly what I don't want. I thought he's trying to humiliate me. He wasn't. He was trying to humble me, maybe. And sure enough, he was right. I found 10 numbers, and it was hard. I had to really scrounge to find 10. The very first phone call I made, talking to a man who I didn't have much in common with, just maybe 20 years older than me, blue-collar guy, but a nice man. I'd met him in a meeting here or there, and he was so kind. He was so understanding. Just talking to him again, telling him the facts about what just happened, it really made me feel like things were going to be okay. Something else happened during that time. I was going through the process of trying to deal with the hospital censure, trying to make sure that this didn't become a board issue, talking with the monitoring agency, trying to show that I really, really did want to get better. Meanwhile, really buoyed up and helped by this new feeling of openness, of just telling the truth, talking about how bad it really was and feeling so much better for it. So much so that when one of the doctors who was a real champion for me to try to save me and save my career, he told me that the credentialing committee, when they reviewed my case about whether or not they should let me continue at the hospital, that one of the doctors on the hospital said that I shouldn't be allowed back in because I was obviously not intelligent enough. I was monitored, but I still relapsed, and that's just absolutely stupid. As a psychiatrist, as a matter of fact, I think. But it didn't bother me because I think I had begun to discover something very new, very revolutionary for me. But in the process of trying to find 10 people that I had phone numbers for, I started to dig into the numbers of the people that I had gone to rehab with. And I went to treatment at the Farley Center, where I ended up working about 5 years later. Never would have imagined. And the Farley Center is known for treating doctors and nurses and pharmacists and dentists who have drug and alcohol problems. My roommate in treatment was a neurosurgeon from Denver. And I really loved this guy. I admired him. He wasn't the warmest fellow. As a matter of fact, I think one of the reasons why I admired him was because he was so cool. He didn't seem to need anything. He didn't need help. He didn't really need to talk. He kept to himself. He kept things under control. You saw the picture already. He looked like George Clooney. I couldn't find a real picture of him, so I put George Clooney. Imagine George Clooney, brain surgeon. But I actually admired him because he never cried. He never showed much emotion. He didn't really need to reach out. So fortunately, I had his number, and I called him for the first time. It had been 2 years since we had been in treatment, and I called him as maybe the 8th or 9th person to tell about what had just happened to me. I got his wife. He didn't answer, and his wife told me sadly that Brian was dead. That a year previous he had relapsed like I did, but that he didn't make it. He got caught trying to pass off a fake prescription for himself while his family was away at Disneyland. Don't know why he did that, but he did. And he was caught. He got arrested and went to jail. Attorney got him out of jail. He went home. He found a bottle, or he bought a bottle of vodka, drank the whole thing, and killed himself. I admired Brian because he didn't seem to need anybody, but the truth is he did need people. He needed me. I needed him. And at that moment, I realized that not being a doctor was the least of my worries, that I am glad and lucky to be alive. This disease kills people. It kills good people. It kills brilliant people, good-looking people. And I was fortunate that it hadn't killed me. I was fortunate that at that moment I was still free. I wasn't in jail. I was still married to a great person. I still had a loving family. I still had choices. I was still able to do something with my life, and I loved that. I felt so fortunate, so much that I even, as I was going through this process, began to ask myself, maybe I shouldn't be a doctor anymore. Maybe it's not good for me. Maybe I should do something else. And that was the first time ever I had ever admitted to myself that possibility. And it didn't bother me. I felt okay about that. Not that I ended up choosing not to be a doctor. Obviously, I thought about it and decided, no, I really like being a doctor, and I would like to be one. And if I get a chance to be a doctor again, I'll be the best doctor I can be. But being able to let go of that for me was so freeing. It was such a sense of relief, of realization, of just fearlessness, because I was no longer concerned about the idea of what I thought I was supposed to be, the idea of what I thought would make me a person that other people would love. I realized that these people who care about me, they care about me regardless of what I am. They love me for me. As long as I'm doing the next right thing, they're going to be there for me. And it doesn't matter if I carry a title. It doesn't matter if I am seen as heroic. It just matters that I'm me and I'm doing my best and I'm there for them. That's what really matters. The story after that is a lot brighter. I was able to come back to the hospital, finish out my training. I was allowed to remain a doctor. And I found myself wide open possibilities, really didn't have a job. I had been focused on critical care medicine, but canceled all my fellowship applications when I went away to rehab. And so I decided at that point that maybe I really need to pursue something in the addiction field. I really wanted to help other people who'd gone through what I'd gone through. And I felt sort of a knack for it. I felt like that really is something more my style, more fitting for me. It feels better for me. It's my skill set. I had to sort of create my own career, because you can imagine in 2009, there weren't very many jobs out there for addiction medicine expert. There certainly wasn't a pathway for me to follow. I was going to have to create my own. So I took a job that was open and available, treating patients, unassigned patients in nursing homes, so that I could take whatever opportunity I could find in addiction while I paid the bills by working in nursing homes. Well, it turned out that working in the nursing homes, I quickly realized that things could be better here. This type of work could be done in a better way. And so as I was gaining experience in addiction, my day job as a geriatrician became a company that I formed, and then it grew. And after just a few years, it became a company that was bringing in a couple $1 million a year. And because of innovative ideas that myself and a partner had about how we could deliver better care in nursing homes. And so I took that success, realizing a skill that I never thought I had, to innovate and to be an entrepreneur and to do something new, along with my new credentials and experience and reputation in treating addiction, and launched another company called the Virginia Center for Addiction Medicine. And VCAM is a treatment center that focuses on outpatient treatment and integrating addiction treatment with the rest of mainstream medicine. As I realized, as probably a lot of you have, that we're not very well equipped as it is as physicians despite being part of a fantastic and wonderful hospital like Medical College of Virginia or any of the private hospitals in the area, we aren't very well equipped to help people with this disease of addiction. And we've seen the results of that on the headlines of the newspapers for the last few years. And I hate to say it's getting worse. I felt like we needed to have an entire reworking of the way we approach this disease. And so put together a group of multidisciplinary treatment providers, brought all the most evidence-based practices together into one clinic, and we called it Virginia Center for Addiction Medicine, and it's going quite well. And I'm very proud of it, and I feel like we're on the way to make a difference. I never would have thought that when I was a kid, imagining dreams of being a hero, I never would have imagined that I would be comfortable with standing up on a stage and admitting that I was a recovering drug addict. I wouldn't have dreamed of that. But I also would never have imagined that I would be after 5 years out of finishing residency, have built and sold one innovative company, and in the process of building a second that has the opportunity to change the way an entire field of medicine develops. I never would have thought that either. I would have liked the big shot sounding stuff, but I don't think I would have liked the price I had to pay. But the message I'm trying to deliver is that by realizing what it is that makes us special doesn't come with titles. It doesn't come with winning. It doesn't come with accomplishments even necessarily. What makes us special is life and others and love and friendship. The experiences I went through allowed me to break out of this gilded cage that I had built for myself as this crazy, precocious young person who thought he had to win everybody's love. And I realized through this experience that although being a doctor is a very special thing, doctor is not necessarily who we are. It's part of who we are. It's a special job, but it's not who we are. I might be an extreme case. I think that I know that many of my classmates and colleagues went into medicine for just the right reasons and became fantastic doctors, even some in this area, who always had the right idea about what they wanted to do. But for me, I realized that although I love being a doctor, and I'm good at being a doctor, that who I am is much deeper than that. And that the value of having a title and being recognized for something that you've accomplished on the outside is really nothing compared to the value of being free, of being alive, of being healthy, being happy, of love and friendship and family, of having a clear conscience and living an honest life. Those things are what really make life joyful. And so my message is to realize that although we are doctors, and it's one of the few jobs in the world where you don't just say, I work at, or I do this, you say, I am a doctor. We are doctors, but we are also people, and we're people who have special value regardless of what we do for work. One of the inspiring things my sponsor told me in those early difficult days was that my kids don't care if I'm a doctor or if I dig ditches. They just care that I'm there for them and that I love them, and he was right. Another thing one of my early counselors told me, which always stuck with me even through all these difficulties early on, was that we as people, we don't bond together over shared success. We don't bond over our most wonderful traits or our greatest accomplishments. We bond together over shared weakness. And he was true. It was true. And realizing that and being willing to show that vulnerability, that needing help, asking for help, getting help, and giving help, that's what really, really binds us together. I finally have come to a place where I realize I still struggle with all of these things today. I don't want to make it sound like I've got it all figured out. But I've definitely come to a place where I realize there are things I want and there are things I need. And that it's much more important for me to to focus on those more important things, those things that I need, the things that make me truly, truly happy, and not at all so much on what I think I might want. It's such an important message to remember, and I want to thank you for giving me the opportunity here to remember it. And thank you. This is the website for our practice. Thank you very much.